Hey, good morning. This is Mike Cason at AL.com. I'm here in Montgomery at the Department of Public Health, where State Health Officer Dr. Scott Harris is about to give us his weekly update on the COVID-19 pandemic in Alabama and the surge that we've now been experiencing for about 2 months. So hopefully we'll get the latest from Dr. Harris on hospital capacity, ICU beds, vaccinations, and maybe we'll get his thoughts on President Biden's vaccine mandates announced yesterday that have already drawn some stiff opposition in Alabama, including from Governor Kay Ivey. So thanks very much for watching AL.com. Please read about the pandemic on AL.com, and let's go hear what Dr. Harris has to say.
Man, that's a huge delay. I'm not. Yeah, I'm going to the IC right now. Bye.
This is a news release we're going to send a little later, but since y'all are here, that way we can, if you have any questions. That's a news release that's going to go a little later.
Okay, thank you.
Thanks. You got no problem. Sorry. Are you on?
Thank you.
You on one?
No, I'm good.
Okay.
Hey, Mike. Hey, good morning, Dr. Harris.
How you doing?
Good.
Good morning, Dr.
Hey, how are you? Hey there. How's everybody doing?
Good. How are you?
Still here? Still here?
Ron and I were talking about how you're a celebrity now.
Man, that's
Not by choice, huh?
that is a bad situation, let me tell you. That's bad for everyone.
We went ahead and gave them a copy of that on the
Oh, yeah, okay, good.
Just so I figured that way they could ask questions here instead of later.
Okay, thank you. Well, it'll be good for everyone when I'm not a celebrity. That's the day we're all shooting for.
You have about 2 minutes.
Okay, that's fine. Just let me know.
I'm just going to move this over to the side.
Sure, I'm sorry, yeah.
No, you're fine. I just blocked your face, and I was like, oh, no.
No, not a problem.
I'll put it right here in front of your coffee.
I may get behind it anyway.
They asked you to wipe down.
Here, I get.
Fine.
Yeah. You good, Jeff?
Yep. Thank you.
I can't hear.
Oh, okay. Well, they're in weather right now.
We're going to get started in just a minute, everybody. For you guys on the phone, just remember to hit *6 to unmute and then *6 again to mute yourself afterwards. Thank you.
It's 11 whenever you're ready, Dr.
Ready? Okay. You guys ready? Hey, good morning, everybody. Thank you for being here today. Appreciate you making time for this. We just wanted to do an update for you all and give you all an opportunity to ask questions. It is still a very difficult time in the state right now. We are still struggling with a lot of high case numbers each day, with a lot of people in our hospitals, particularly our demand for ICU beds continues to be a significant issue, and I've got a lot of information I want to present to you about that. I'll start off talking about schools. We continue to see very high numbers of cases in our schools. This past week, we had reported about 8,400 cases reported in our school-age kids. There were actually 138 out of 143 school districts that were reporting to our dashboard this week. That number compared to a year ago, this same week a year ago, is about a 605% increase in COVID-19 cases among school-age kids. That's comparing this past week with that same week a year ago. That's a very difficult situation to be in. As you know, there are a number of school districts that have already gone to virtual on a temporary basis at least. We know that there are numbers of kids who unfortunately have had to be sent home to quarantine as well, or who are actually infected and have to be out of the classroom setting as well. It is very important to us that we keep kids in the classroom setting for face-to-face instruction as long as we can do that safely. It is vitally important that our schools take the measures that they need to take in order to keep kids and educators safe. We continue to very strongly recommend universal masking in all of our K through 12 schools. That is one of the best things that you can do to keep kids in the classroom setting. As you know, when students are consistently masked and schools are doing the things they need to do to mitigate infections, then those kids don't need to be quarantined if they're exposed to a case. This is a really simple, straightforward way to keep kids in the classroom setting, and we would encourage all schools to adopt universal masking. I believe I heard Dr. Mackey say this week more than 90% of schools have done that, and we applaud them for doing that. I know that's not without controversy. I know that there's a lot of debate about that, but it is clearly a very easy, straightforward way to help reduce infections in our schools. Also, for those students who are age 12 and up, they are eligible for vaccination in just about every case with the Pfizer vaccine, and we would encourage people to do that as quickly as possible. With the Pfizer vaccine, you remember a shot would be needed today, and then a second shot at least 3 weeks later, and then a couple of more weeks are needed beyond that to realize the full immunity from that vaccine series. So we need people to get vaccinated as quickly as they can. The real benefits of getting vaccinated, starting to get vaccinated today, aren't going to be seen for 5 or 6 weeks. If you want to have a normal school semester, or as close as we can, if you want to have a good holiday season with Thanksgiving and Christmas coming up, this is the way that we do it. We get people vaccinated now so that 2 or 3 months from now we can try to get back more or less to normal, which is somewhere we all very much want to be. In terms of our hospitalizations, we have had a little bit of a plateau over the past week. I'm very thankful for that. The numbers aren't great, but the numbers at least have not continued to go up. We reported, hospitals reported yesterday 2,667 COVID patients that were confirmed, have confirmed diagnoses in Alabama hospitals. That's the first time we've been under the 2,700 mark in a couple of weeks, I think, certainly 10 or 12 days for sure. We have 53 pediatric patients that were reported to us. We continue to have a real crisis in Alabama with our ICU bed capacity. Yesterday there were about 60 or so more patients requiring ICU care than we have ICU beds in the state. So that's 60 patients who are receiving critical care because they're critically ill, and yet they don't have an ICU bed. They're being cared for in an emergency department or in a ward bed that's been converted to an ICU room, or on a gurney in the hallway or somewhere other than an ICU bed, because we just don't have enough space to take care of them. We added yesterday about 4,800 cases that were reported to us. Now, not all of those occurred yesterday, but that were reported to us yesterday. A total of 53 additional deaths were reported to us yesterday. Remember, we have to go through the work of verifying that. Sometimes the number of daily cases and daily death reports that we have take a little while before they show up on our dashboard once that's all been verified. But we're continuing to see reports of double-digit numbers of death every day, and that's been fairly consistent now for a month or so, unfortunately. In terms of the deaths, we have frequently updated you on the number. We've gone back to the first part of April when vaccines were widely available, just to compare the deaths occurring in people who were vaccinated versus the people who were unvaccinated. We've actually seen a total of 145 deaths since April 1st in people who were vaccinated. About 90% of all the deaths we've seen are occurring in people who are not fully vaccinated. So there's a 9-to-1 increased risk of dying if you're an unvaccinated person, which is very consistent with what we know about how well the vaccine works. Out of all the people in the state who are fully vaccinated, 0.01% have died because of a breakthrough infection. So 0.01% of people who have been vaccinated have died with a breakthrough infection. We are doing a little better with our vaccination numbers, as we've seen over the past couple of times we've talked. We're very grateful for that. As of yesterday, we had about 2.36 million people in the state who received one or more doses, about 1.85 million people who are fully vaccinated. We still lag way behind a lot of the country, but we're actually ahead of 8 states as of this morning in terms of people who've had one or more shots. We're still one of the bottom 1 or 2 in terms of people who've completed the vaccine series, but because we've seen this surge in the past few weeks, we're very hopeful that we're going to start moving up on that scale as well. So I want to thank all the people who are out there giving these shots. We have people who are working really hard, people in public health, people who work in our hospitals and clinics, and other people in the private sector, people who work in pharmacies, the chain pharmacies and independent pharmacies. All of them are doing a terrific job of trying to get people vaccinated, and we want to encourage them to continue to do that. As you know, we're rolling out our Kick COVID campaign around college football. We talked about that last week, and that will provide vaccination sites and some testing ability too on campus for home football games for most of the colleges in our state, for all our FCS and FBS schools. And we'll be glad to give you more information on that, but we look forward to that beginning very soon as well. I wanted to let you know a little bit about monoclonal antibodies. As you know, monoclonal antibodies are a very effective, highly effective way of preventing people from becoming seriously ill if they're infected with COVID. They can also be used to prevent infection in people who've been exposed to COVID. We strongly have advocated that. We work very closely with the Medical Association and with others to try to enroll new providers in doing that. We actually learned last week from HHS that Alabama is going to be on an allocation in terms of the amount of antibodies that we can order. So providers in our state have been told that they're likely to get about 70% of the antibodies, monoclonal antibodies supply that they are asking for. We had not had any limitations before last week, but several states in the southeastern U.S., states with low vaccination rates, are seeing real surges in a demand for monoclonal products, and so that's led to this temporary allocation process. They tell us that'll be over in October. Don't know exactly how long that will last, if that's early October or late October, but we are up to about 228 providers now that have received monoclonal products so far, and have been administering those. You can see those locations on our website now. We have a map up that shows where to get those for people who are at high risk for serious illness or death because of their age or because they have chronic health problems. Please talk to your doctor or your provider if you've been exposed to COVID as a close contact, or if you have COVID, to see if you qualify for a monoclonal antibody product. These are for people who are at risk for getting sick but aren't sick enough to be in the hospital yet, and you really have to do it quickly. We want to give them as quickly as possible, but always within 10 days of your illness beginning. So please talk to your doctor or your provider if you might be a candidate for that. We are planning to expand a couple of new sites through our federal partners this week. We'll give more information on that as soon as that's settled. We know that one of our vendors, KPMG, has been talking to about 6 different locations and negotiating contracts with those around the state, and we hope to have that announcement very soon about where those are going to be, and we'll let you know more about the capacity and the hours and all that as soon as we have that. We found that our South Baldwin Hospital federal team, unfortunately, was not extended. They demobilized this week and moved on to do other work in other states. We did get a extension for our team that's in Dothan. They're going to be here for several more weeks. We're very grateful for that. And we had the arrival of a federal team, a Department of Defense active military team that came to Dale Medical Center in Ozark, and we have already been approved to have that team extended as well. So they'll be here for several weeks. We're very, very grateful for that support. We appreciate our federal partners helping us doing that. We have teams from HHS that are also doing assessments at 5 other hospitals in the state. These are hospitals in Monroe County and Flowers Hospital in Houston County, North Baldwin Medical Center, Troy Regional, and Thomas Hospital in Mobile County. Those 5 facilities are being evaluated by HHS for the possibility of receiving some federal staffing assistance as well. We had the announcement last week about money that was made available to hire temporary nurses, as you know, or temporary staffing for hospitals. We worked with our state finance department and then with the governor's office to obtain about $12.3 million that was available from CARES funding. The health department had an additional $1.2 million that we had unobligated that we added to that. So using that money, we are working with the Hospital Association, who's contracted with a staffing service named Vizient Incorporated. They're a well-known healthcare agency from Dallas who've done a lot of staffing in other states. They've been staffing in Missouri since, I think, December. They've done a lot of hospital staffing in Arizona. They've also done some work with some other states as well. So we're in the process of getting that worked out. Those traveling nurse rates, as you know, are expensive. It's not without controversy when you have local folks who've been working here and are making whatever they normally make, and we have these travelers come in who are making a lot more. That's not an uncontroversial thing, but we really don't know what else we can do to help our hospitals at this time. Staffing is at such a crucial level. We are really concentrating on trying to improve our ICU capacity, since that's really been the biggest issue we've seen for the past few weeks. So we'll hopefully have more information about that soon as that all gets fleshed out. I wanted to let you know that we are continuing to see the Delta variant causing most of the cases in our state. What we have done in terms of testing we're aware of, it's well over 80%. CDC estimates are more than 95% of the specimens coming from the state are attributable to the Delta variant. We have been asked by several people about the Mu variant, another one of the variants that's been reported around the world. We actually have had 3 cases of that in Alabama. It's not clear how important that is right now. Mu is not a variant of interest, much less a variant of concern, according to CDC. The WHO has labeled it a variant of interest. It's not clear that it causes worse disease. It may be more infectious. It's not clear whether it's covered well by our current vaccine products. It certainly is not occurring in high numbers. It certainly has not displaced Delta at this point, but we'll keep you updated on that as we learn more about that. Just a few other things. CVS announced this week that they're going to open about 13 drive-through testing sites for COVID. So we're very grateful for their assistance with that. They're particularly trying to focus on high-risk, underserved communities. They're going to be testing in areas of Jefferson County, but also in Anniston, Troy, Aliceville, Greenville, Scottsboro, Mobile County, Warrior, and Florence. Those sites you can find at CVS.com. People can access a scheduling tool and get tested there at the location that's closest to them. So with the increased number of cases we're seeing, we're very grateful to them for being able to do that. Finally, I'll say breakthrough cases. We've had now about 22,000 total breakthrough cases reported to us since April. That is, people who are fully vaccinated who have been infected anyway. That number is actually a lot less than we would predict. We have over 1.8 million people who are fully vaccinated. We know that the vaccine effectiveness against the Delta variant, which is what we're seeing now, is probably 80-something%. And so it wouldn't be surprising to have a couple of 100,000 breakthrough cases. But at this point, we've seen about 22,000 that we know of. So I think that's all the things that I had to tell you, but I'd be glad to answer any questions at this time. So. Yeah,
I have a
go ahead.
question. So yesterday Biden gave vaccine mandates. Governor Ivey called them outrageous, overreaching. What do you think about mandating vaccines?
Yeah, the politics of the issue, I really, I'm not in a position to talk about that. I would just say our goal is we want everybody vaccinated as quickly as possible. It's the best possible way to get out of this. We're still studying what that means for our agency. We have federal contractors who do, healthcare facility inspections, for example. We have a home health agency that works in public health, so we're still not quite sure what that means for us. We're still trying to figure that out. But the takeaway is we just want everybody vaccinated and as quickly as we possibly can.
Dr. Harris, Brian Lyman with the Montgomery Advertiser. I wanted to ask, the cases that we're seeing among school children, is there any pattern to that? And are you seeing any evidence that school districts that are employing masks are seeing less or fewer cases as a result of that?
Brian, I don't have enough information to answer that. We get asked that a lot, and depending on which side people are on, they've all got an example of why masks work or why they say they don't. But we don't actually have visibility on which school districts are are requiring masks or not. I read that in the press when you guys write about it, but we don't otherwise have the ability to know that. I will, I'll add to that though. We absolutely believe that it's the right thing to do. Masks aren't magic, and it's not the only factor that's going to determine whether you have an outbreak in your school or not. Masks, are just another layer of protection. We ask people to wash their hands. We ask people to keep their distance. We ask people to stay home when they're sick. We ask people to wear masks. We ask people to get vaccinated. All those are really, really important. All those, play into what's going on in your school. The amount of disease transmission going on in your community also plays into what's going into your school. I don't think it's I don't think it's really, honestly, a good question to ask. There's just never going to be a one-to-one correlation with mask and cases the same way there's not a one-to-one correlation with do you wash your hands or not in cases. It's just another layer of protection that we want people to do.
Dr. Harris, this is Brendan.
This is Cynthia in Birmingham. Quick question. So you're saying we're being limited on the monoclonal antibodies, but last night the president said he's freeing up a lot more. Can you talk about that timetable? Is that going to be resolved?
Yeah, I would agree with you. The messaging's a little bit confusing to us as well. The call that we had last week with federal officials, just categorically said there's no shortage of monoclonal antibody products. However, the states that are ordering a lot of them are going to see their orders reduced somewhat. So, it's effectively like a shortage, even though I guess maybe absolutely there's not a shortage. I think they're trying to ensure that there's not product still on the shelves that hasn't been used. As you know, we've been authorized again to start using the Lilly monoclonal product, the so-called BAM-HEDI product, which had been on hold for a while. And so I think they're just trying to make sure there's more of a national distribution, a little more evenly. And again, they told us that this ought to be worked out by October, and that was as specific as they got. So I really don't know more about it than exactly what I told you there.
Dr. Harris, this is Brendan Kirby from WAOA in Mobile. I was wondering if you could give us the latest figures on people who have been reinfected, infected a second time, and compare those to the vaccine, the breakthrough vaccination statistics as an overall matter, and also if you've got that from people who've been hospitalized and died.
Yeah, I'll do my best. I've got some of those numbers. We have had reported to us about 8,111 people who've been infected at least twice. Of those numbers, we've had 71 deaths that we've confirmed out of that group. So that's just slightly less than 1% of the people that are known to be reinfection. So it's always hard to know, if you're capturing all that, if people get reinfected but don't get sick enough to be tested, or, sometimes it's hard to match a case this year with the same person last year if their demographic data is a little bit differently. But that's a number that we know about is 8,111 confirmed reinfections.
And you've got the same limitations with capturing the breakthrough rates too, if people aren't sick enough to go seek testing. But based on the data you have, do you have any conclusions as to whether the vaccine offers comparable or better or less protection than natural immunity?
Yeah, I mean, listen, please don't go for natural immunity, because overall, in terms of our overall case numbers, about 2% of those people are going to die. So, your rate of, the rate on reinfections of death is just under 1%, but that only applies to the people that didn't die the first time around, right? Because they're not getting reinfected. So, we know that the vaccine is safe and effective. We know from laboratory studies that the most robust immune responses anybody has are people who have had natural infection who then subsequently get immunized. Those are probably the most protected people at all. So the natural immunity argument is usually, and not implying that you're saying this at all, but it's usually from people who are just skeptical of vaccination. And it really shouldn't be that way at all. If you're fortunate enough to get infected and survive without any difficulty, please go ahead and get infected. Don't take chances on getting infected again, infecting other people around you. Please get vaccinated, I should say, because those are the people that have the most robust immune responses.
And that would include even people who have had it the first time around. There's a benefit in getting vaccinated, even if they have the natural immunity from the first infection.
Yeah, absolutely. I think the most recent, data we all saw on that was the MMWR report, and it was from Kentucky. But those folks that were vaccinated afterwards, compared to people who were infected but not vaccinated afterwards, I think they had about a threefold or so reduction in their risk of getting infected. There's no question that you reduce your risk a lot more with vaccination, even if you've been previously infected.
Thanks.
Dr. Harris, the plateau that you talked about in hospitalizations, what do you attribute that to? Do you think that's going to be sustained, or what?
Yeah, it's really hard to say because we don't always, understand, what makes the numbers go up and down. But, I would just say we've been here before. We had, our earliest numbers, a year and a half ago, which weren't huge spikes, but, we had a few hundred people in the hospital. We had a really difficult July and August, if you remember, and then we had the, biggest numbers of all in December and January. At some point, these spikes occur and then they recede, and it's not clear if, is it because you just have a lot of people infected that we don't know about and they're temporarily protected? Is it because people see these numbers and they start changing their behavior and they just don't put themselves at risk anymore? Certainly now you've got the variable of, you've got a lot of people vaccinated as well now, and so there's an interplay in all those things. We saw in the UK and in India when Delta hit there, they had a couple of really bad months, and then those numbers started receding in both those countries, even though they're back in the UK now. But those countries are really not alike at all. India had very low vaccination rates. The UK had very high vaccination rates and a partial shutdown in place. And yet in both those countries, it kind of burned through in a couple of months. So maybe that's just something about the natural history of what this infection does. But I would say, you've heard me say this before, the one thing we know is that we don't ever really know, and it's just really hard to predict. But I would just say we're encouraged that numbers aren't still going up, and hopefully they'll go down.
Dr. Harris,
Yeah.
so a lot of the advice that's been given to people who are hesitant to get vaccinated is go talk to your local doctors. We're hearing that some local doctors are telling people not to get the shot. So what's being done to get more doctors on board on the same page?
We know, well over 95% and, probably closer to 99% of doctors in America who've been offered the shot have taken the shot. So I know there's some doctors out there who, have said otherwise. Doctors aren't a homogenous group. There are different levels of training and expertise, and there's no question that there are times when people's political beliefs play into those sort of things. I don't think that happens often, but it certainly does sometimes. And I guess we don't expect everybody's going to offer the same exact advice, but what we hope is that all healthcare providers, whoever they are, will just look at the best available medical evidence, and the conclusions are pretty clear. Most everybody needs to be vaccinated. There could certainly be some exceptions, and are some exceptions, but in most cases, most everybody needs to be vaccinated.
So there's no
Dr.
initiative.
Harris.
I'm sorry. Just 1 second. I got to follow up here.
Sorry. So there is no like initiative or anything. Just like look at data, things like that.
I mean, not by us. I mean, we don't regulate physician practices, in public health. That's not our job. It's not our authority. So we are not investigating that, no. I'm sorry, back to the phone.
Yeah, Dr. Harris, Darwin Singleton with NBC 15 in Mobile. We've got more than a half dozen immunizations and vaccines that have to be given. In fact, the state of Alabama mandates that they be given before a child can enter school. How is this vaccination or vaccine different, this mandate that the president has proposed? I know you don't want to get political, but I'm just trying to figure out if there's a difference between what he's mandating and what the state of Alabama is already doing.
I mean, I guess if I understand what you're asking, I mean, certainly, there are required vaccines for public schooling in every state, and Alabama is no different there. This obviously is a very new vaccine. It didn't exist a year ago, and we've only had about 3 weeks that it's actually been an approved vaccine, and it's still not approved for most kids. It's only for older adolescents and teenagers. So I'm sure those discussions are going to be had, down the road. I think it's just early to weigh in on that yet. I think we just need more time. We need to see what other products are going to be approved, and then see what the data is on vaccinating kids, and those discussions I'm sure are going to be held.
Well, does this apply to adults as well then? I mean, if they're mandated, the state has a mandate. What's the difference between the federal government having a mandate for vaccinations just because we're adults?
I mean, I guess I'm not aware that we have a mandate that you have to have a vaccine. There's just requirements that employers can have about who can work for you or who cannot work for you, and I think that's a different issue. The federal government is certainly not state government, and I don't think I really have an opinion on how they do that.
No. But I see that point. I see what you're saying there. Okay, thank you.
Sure.
Dr. Harris, this is Morgan with Fox 6 in Birmingham. Going back to the monoclonal antibody treatments, do you see this is the 70% of what doctors are going to be ordering? Do you think that's going to have an impact? Like, does the state keep track of how many treatments are being given? Do you foresee them having to change criteria to meet with whatever product they have on hand?
Yeah, I think we're not sure yet. It is going to have an impact in the sense that we have had, as these numbers have increased recently, we've had a lot of, fairly new providers, people who haven't been administering monoclonals before, who've come on board recently. So that, that's kind of like the cause and the effect, right? I mean, because we've had this increased use of them, it's why suddenly states like Alabama and the South have had so much demand, and why we're now being allocated. So I think that temporarily there's certainly going to be some folks who were expecting to be in this process, providing this for patients who aren't going to have the supply they anticipated. The 70% number is not some hard and fast number, I should say. It was just a sort of a ballpark that that HHS estimated. That the state's probably going to overall receive about 70% of what they ask for. I don't think it's, to my knowledge, there's not a hard and fast formula. I think it just depends on how much is being produced each week and how much is being sent to the rest of the country each week.
Dr. Harris, when you look at, I know you have demographics breakdown when we talk about the unvaccinated and such, but when you look at race, gender, sex, what jumps out at you there? What are your concerns there? And what are you doing to get those groups online?
First of all, Alan, we could be doing a lot better job with every demographic group. So, I'd say they all jump out in a way. We actually in Alabama have vaccinated a slightly higher percentage of African American Alabamians than we have white Alabamians, and I think that's in part because we've really tried very hard to listen to leaders and officials in that community to make sure that we were communicating in the right way. And so we're proud of the work that we have done. In many states, most states, vaccination among African Americans in those states has lagged those of whites, but not here in Alabama. That said, they're pretty similar. We've gotten around a third of overall eligible white population and a third of the overall eligible African American population. So we still have a long way to go. Vaccinations are certainly more common in women than in men, and that's almost true for every health indicator. Women, just generally speaking, make better health decisions than men in general. I mean, I think that's recognized, even though we don't quite know why that is. So we certainly could be doing a better job in vaccinating men than we are doing. And there's no question that we've had a lot more success vaccinating seniors than we have other age groups, and particularly under age 50. You know, we've done an okay job in the 50 to 65 group. We've done a good job in the 65 and up group. But, you know, under age 50, we have a lot of room for improvement.
When you look at vaccine hesitancy, and here we look at all of our newscasts, and most of the time we are now referring to health leaders, we're in a crisis situation. The vaccine hesitancy, we're still seeing it. Is it changing enough for you at this point? Are people still hesitant for the obvious reasons, or is anything? Are you making a dent in the obvious? I know that there's political, but I also know some people don't know. Where do we stand on cracking some of those obstacles, and do you think it's going to be enough to get that goal where you want to be?
Yeah, I mean, clearly there's still some hesitancy for sure. You know, even though we've seen our rates go up quite a lot in the past month and a half, they're still about half of where they were in March and April. Well, certainly April when we had plenty of vaccine to go around. So we've still got a long way to go to get to where we need to go. I think it is encouraging that we've seen, you know, our vaccine numbers go up, though. They're 3 or 4 times the numbers we were vaccinating at the end of May and into June. You know, probably a lot of that has to do with people who have a personal experience with this disease. I think that can overcome a lot of your hesitancy when you or your family's actually been touched by this, because you know somebody who's experiencing illness or worse. So, you know, vaccine hesitancy, as we've said many times, comes in a whole lot of different shapes and forms, and there's not one message that applies to everybody, and there's not just one kind of hesitancy, and a lot of people are moving in the right direction, and there's still a lot of people we haven't reached yet.
You talked about also going back to trying to hire nurses, more nurses. It's now up to over $13 million. Do you think you can make it? Because the way Dr. Williams is talking, basically Alabama is in a bidding war, and other states are in a bidding war. Do you have any idea how many you could hope to get? I know at one point it seemed like you took 250, but is that even that going to be realistic? Well, how competition is out there?
Yeah, I mean, clearly those rates, you know, float quite a bit because of market forces, and so as case numbers go up all around us in neighboring states, you know, there's going to be, you know, more demand, and it's going to get more expensive. I think we're just trying to do the best we can. You know, whether we get 250 or whether we get 200 or some other number in that range, it's still vastly below what Alabama needs. You know, I mean, you know, the first couple of dozen hospitals that sent in their own assessments of their staffing needs indicated they needed about 500 nurses, and this was just, again, you know, 20% of Alabama hospitals who were reporting to us. So we're still getting information from other hospitals as well. There's, you know, there are just huge demands right now. I think the one thing that's somewhat, you know, discouraging in a way is that, you know, when you have hospitals that are overrun by, like they are right now with patients, it really feels like a failure on our part because, you know, 85 to 90% of these people are unvaccinated. You know, most of them are preventable cases. Most of them don't have to be in the hospital, chances are. You know, a few vaccinated people do end up in the hospital, but most of the time, people who are vaccinated don't get sick enough to go to the hospital. So when you see this huge surge in numbers, it's a crisis because it affects anybody who needs a hospital for any reason. You know, you may not have easy access to the care you want, but it also just feels like that, you know, we weren't able to successfully communicate with somebody and prevent that infection that could have been prevented.
Hey, Dr. Harris, this is Brian Lyman with the Advertiser again. I just wanted to kind of follow up on Mike and Alan's questions there. But you mentioned earlier that the hospital, as we've seen, the hospitalization rate has plateaued. at least for now. But obviously, considering the ongoing crisis in the ICUs, I mean, is it fair to say that people needing hospitalization, but for lack of a better word, like our hospitals dealing with again, for lack of a better word, a sicker population than they might have been dealing with in July or August at this point?
Yeah, I think that's true. You know, interestingly, the number of or the average age of the people in the hospitals now is significantly younger than we were seeing even in January, and definitely back in before we had vaccines back last summer. So we do have a younger overall population, and yet more of them are receiving critical care. So that's kind of interesting. I think probably hospitals are a lot more experienced. You know, they're probably just better at figuring out who actually does need to be in the hospital and who doesn't need to be in the hospital. And so we have a lot of these patients who are much sicker patients who are showing up, and those obviously are the ones that get admitted. I had a conversation with a hospital administrator yesterday who said they had critically ill patients on the floor, and they were having to triage who they could move to their own ICU. You know, they were patients who needed ICU care and weren't officially getting ICU care, even though obviously they were doing everything they could to take care of that patient. So, you know, looking at, in a more abstract way, looking at the Delta variant around the country and around the world, it's not clear that Delta causes worse disease overall, but for whatever reason, we definitely have a higher acuity of care that's needed for these patients that we've got in Alabama hospitals today.
Dr. Harris, this is Brent. Go ahead.
Could you comment on the Pfizer announcement about seeking approval for the first COVID vaccines for young children 5 to 11, and also the plans for the children 6 months to 2 years old later this year? Have you been following that, and what are your thoughts?
I have to be honest, I did not actually see their announcement. I know in general terms what that discussion's been, but if you can enlighten me on that, maybe I can tell you what I've heard on that.
That's fine. That's fine.
Yeah. I've not seen any more, except that clearly those studies have been ongoing, and you know, it's anticipated that there'll be approval for younger kids fairly soon. You know, the exact age cutoffs, I don't know. The last conversation we had with federal partners about that issue said that they hope that younger kids, you know, younger age school kids, might become eligible sometime before the end of this year, you know, into 2021. But I don't know any more about it than that.
Yeah, Dr. Harris, Brian Kirby again. The New York Times reported yesterday that the CDC was investigating several early deaths as possibly COVID-related, including one from Alabama in January, I believe, of last year. Do you know anything about that, and what community that person was from?
I don't know anything about that.
Okay.
I have not heard that.
Dr. Harris,
Yeah.
Along with the federal help that we're receiving to hospitals, is the Alabama National Guard involved in any of that?
Oh, you know, we worked with the Guard, you know, nonstop. We don't have large numbers of them deployed at this time, but for example, the Guard is helping to oversee the troops that are the federal troops who are here now. You know, we actually have a state National Guard person who helps to coordinate that, and they're called. There's a name for that structure, for that command structure. I'm sorry, it's slipping my mind. But they continue to work with us in a lot of ways. Remember, the National Guard were activated for almost a year and a half, and so we don't have plans to reactivate large numbers of them at this time. The challenge is that the people who are licensed professionals or medical professionals who are guardsmen typically are all working. You know, they're all Alabamians who have a job doing health care, and so you know, trying to request activation and then bringing them in and then putting them back in a situation means we probably have to pull them out of a healthcare environment to try to insert them somewhere else. So,
Dr. Harris, this is Morgan with Fox 6. Just a quick point of clarification. I'm sorry if I misheard this, but I think you were answering a question from Brian. I think that you said you talked to a hospital who were treating patients on the floor. And again, I'm sorry if I misheard that, but can you give a little bit more explanation on that?
oh yeah, I apologize. That's hospital lingo, and the floor does not mean the ground. The floor means not in the unit. I'm sorry if I miscommunicated there. Yeah. Normally we think of a hospital having unit beds and floor beds, but it has nothing to do with the, the ground. So sorry about that.
Okay, yeah. Totally laughed at me. I just heard that and was like, ooh, hey.
No, that's exactly what I said. I forget not everybody can read my mind. So.
Dr. Harris, I was wondering if you could talk about the medical team that went to South Regional Medical Center in Baldwin County. You said they pulled out. Do you know why that term was not extended?
I think it just has to do with the demand for those staff to go elsewhere. There wasn't any particular reason that I'm aware of. We requested that they be extended early on, and it was never clear that they were going to be. They were initially deployed for, I think, a 2-week deployment, wasn't it? 2-week deployment, and that was, it was only ever confirmed that we would have them for 2 weeks, and then after 2 weeks they got deployed elsewhere. So I think it was just supply and demand. Okay. Anybody have any other questions? Okay. Well, thank you all very much. All right. Thanks.